Greg with Medical Muscle. And in this video, I get to interview my friend Adam, a really smart guy. All right, Adam, do you want to introduce yourself?
As Greg said, my name is Adam. I'm a fourth year at SGU, and I'm applying family medicine.
Fantastic. So what made you pick family of all the specialties?
So for me, my journey to family medicine was honestly always pretty straightforward. I knew it was always something I wanted to get into, just the way they approach their practice. It's like very holistic, very thorough, very top to bottom, and the care is continuous. That's what really attracted me to it. And like you have the ability to make changes in people's lives because they take information and from all the different systems, cardio, GI, and they relay to the specialists. They take discharges from the hospital, manage things outpatient. They pick up early murmurs, and so help people live happy, healthy lives at the most basic level. What I ended up finding was there was particular aspects of each discipline that I couldn't really get around. In let's say in internal medicine, like they're very quick fixes for things in the hospital, but they don't necessarily like take everything into consideration. Because sometimes medications like they work in an instant, but they're harmful for them long term. Mm-hmm. So the family medicine guy is going to take that medication, manage it, alter it, change it to a different medication, kind of minimize the side effects, and do the day to day.
Yeah, that's a great explanation. You know, because we're both in family medicine right now. That's how I met Adam, and you're right. Like, you know, in family medicine, you're really trying to catch all these pathologies in every system. So you have to be very smart. You have to be able to catch this stuff. You got to be thorough.
I mean, our attending, the doctor we work with, he's fantastic, and the way like seeing him practice is like so inspiring because it's like he's in a community and people come to him with results and reports from other physicians, and they're like, help me come up with a plan. Like, what do I do now? But you're kind of the stepping stone into moving in the right direction.
You're like the jack of all trades. You get to do little minor procedures. You're dealing with cardiac stuff. You're doing with MSK stuff, orthopedic stuff, a lot of preventative care, obviously. Kind of cool because you know all these things that improve longevity. Talking about family medicine, I know there's a lot of SGU students that go into it. Sometimes family medicine kind of gets a bad rap, I guess.
I definitely agree with you there because I feel like it's a very undersold, especially by SGU. In my fourth year for my core rotations, I was never scheduled for a family medicine. If I wasn't so gung-ho about it, I wouldn't have went out of my way to work with a family medicine doctor and receive a letter of recommendation. You know, I feel like when someone doesn't know what they want to do, they just get pushed into internal medicine. Family medicine can be just as diverse in practice. Going into the residency, you can specialize in all these different tracks. You can do addiction medicine, geriatrics, maternal medicine. You can even do obstetrics, sports medicine, and those are just individual tracks, meaning they don't even add years on the residency. Your residency stays 3 years. And on top of that, you can pursue fellowships. You can do sports medicine, geriatrics, addiction. There's a lot of different directions you can go. I feel like not a lot of people think about that when they think about family medicine. They're like, oh, I'm going to be stuck in a clinic, you know? And then in their mind, their life is over, you know? So you really have the liberty to work wherever you want as a family medicine physician.
So what kind of advice would you have for a student, like say in their first year of medicine?
So first year of medical school, really just be a sponge and learn how to study for tests. That should be your biggest priorities because that's really what it comes down to. Yeah, in my term 5, I actually failed, I think, one exam and the other one I was like right on the borderline. But I ended up making it through term 5. Really just perseverance and staying on track and just learning how to take these exams. And I wouldn't limit somebody who doesn't do well in the first 2 years to any type of specialty that they're going to get stuck somewhere. Correct. Or that they don't have the same opportunities as someone who didn't do well in their first 2 years. Yes, you have to try your best during your first 2 years, but what really kind of makes the biggest impact is how you perform in clinicals.
That's true.
You know, you can turn everything around in clinicals. It's a new slate.
Mhm.
The tests are different. You're graded holistically. You're graded on your professionalism. You're graded on how you perform in the hospital. So the biggest step is to kind of understand that it's not over. Everybody always says clinicals is so easy. You just got to show up. You got to do the X, Y, and Z. But that's not the case at all. The first day of clinicals, I was like, all right, this is a good reset for me because I had a few exams that I didn't do well. I need to turn it around. I need to study hard. And then, so for clinicals, I was just doing Anki every day. I was cranking through cards, specifically the Anking deck.
Okay.
Would try to do like 100 cards a day. So I started with psych. So I had all my psych cards unlocked. And I was doing psych in my next rotation, which was pediatrics. And I was doing pediatrics when I was doing OBGYN. I was doing all that cards just so everything can stay fresh because I knew in my mind that step 2 was always on the horizon and you always had to prepare for it because the shelf exams, yes, you have to pass them. And yes, like they're not going to be determinant of a lot of things in your final grade, but it's only going to help you to prepare harder for those things.
Correct.
So you can really turn it around, and I was able to score a decent grade on step 2.
You did great. Actually, excuse me. You did excellent. From what I've heard, like you did way better than the average student. Like you could have gone into surgery if you wanted with your score, possibly.
But that's the reason clinicals is so important is because if you do the right steps, you have all these different windows of opportunity in front of you. You can apply to anything you want. And then another thing that's really important in clinicals specifically is identifying your areas of interest. At the very beginning of my internal medicine rotation, I was like, hey, like I'm going to need a letter of recommendation. Like I'm not going to have a lot from family because I didn't have a family medicine rotation. So it was at the very beginning, I was like, hey, listen, like I'm going to need one. You let them know ahead of time. Keep showing your face every day. Become friendly. Offer to present all these different topics. And it's funny because everyone always jokes about being like a excuse my French, but like a kiss ass in clinicals. Like, nobody wants to be a kiss ass, but it's like if there's ever a time in your life to do it, it's clinicals.
You're right. No, that's a good point.
You want to be the yes sir, yes ma'am kind of person in clinicals. Like someone tells you to do something, you do it with a smile on your face. Those things don't go unnoticed because I've had a couple interviews where they talk about my personality in my letters of recommendation. They're talking about how I was smiling to them every day. Patients just noticed, even in one specifically, they were talking about my interactions with the nurses and the technicians because they were like, he's very respectful with everybody because regardless of like how insignificant you feel as a medical student, like people will know you, people will know who you are, but when the time comes, like you will be judged, So clinicals is not the time to slack off.
Talking about like how to get letters for family medicine, if you are not able to take family medicine in your third year, definitely get them from IM. Be kind of not aggressive, but be diligent at getting them early. That was a good description. And, really you in every rotation, but I mean, obviously the one that you want to go into or where you need to get a letter from, you're basically interviewing with them. Kind of you're on with every single person. They all talk. Residents talk with attendings. Nurses talk with attendings. Everybody talks with each other, and your reputation is being shared, and it can make a huge difference in you getting an excellent letter, maybe even a residency at that hospital, or not getting those offers.
If they like you, they will go to distances to help you. And coming from SGU and being like an international medical graduate, you want all that help you can get. You want people with established an MD behind their name vouching for you, and not only vouching for you, but like promoting you almost, and that's only done if you can kind of back it up. Like doctors even at the highest level, they don't take shortcuts. They won't let people like slip through the cracks, Like best case scenario, they won't write you a letter of recommendation at all because you don't get to see your letters of recommendation on ERAS. so you don't know what they write about you. And they could write you a very generic letter that everybody else receives and
Yeah.
that every residency reads during application season 20 times a day, like there's always just generic letters, and you don't want to be the person that receives that letter. You want to be the person that when someone opens your application, sees everything and then reads the letters, they're like, I need to talk to this person. Like I can see them here just based off these letters.
Correct. That's good.
And then kind of going towards family medicine, like if you're not given the opportunity to take family medicine in your third year, don't be shy to go out of your way and reach out to a family medicine doctor in the area. And if you have a random day off, random weekend off, or even just sitting down and talk to them, be like, how did you get here? And then being like, hey, can I kind of see what you do in the office? Like, and then kind of getting your foot in the door. And once you get your foot in the door, you can be like, can you write me a letter of recommendation?
I got a message from someone asking, how do I get a letter for physical medicine and rehabilitation? And it's kind of the same situation. You might not have enough time to get that letter before ERAS is due. And this is one way you can do it, is just be proactive and go and talk to someone, on the side and be like, hey, can I shadow you? And then ask for that letter. That's perfect. Okay. That's fantastic. Well, thank you for doing this interview with me. And if people want to reach out to you, if they have any questions, how would they reach you?
Sure. You can follow me on Instagram. My @ is uglyad, uglyad.
Perfect. I'll put that down below.
Sure. Reach out with any questions. I'd be happy to help SGU students out. Or if you have any questions about family medicine, or anything at all, just feel free to reach out. And thank you so much for having me, Greg. I really enjoyed it.
Awesome.
Hope I could have been a little bit helpful.
No, that was great. Thank you. And you guys, again, best of luck on whatever exams you have, and make sure to subscribe for more great content.